What's up mga ka-livestock? Nandito ulit tayo sa ating day 12 sa ating 20 days challenge. And yung i-discuss natin ngayon ay yung isa sa mga pinaka-killer na sakit sa ating mga ruminants, sa ating mga baka, at sa ating mga kambing at saka tupa. We're going to discuss today what is bloat. It is one of the top killers of our livestock. So actually, may two types of bloat. Yung tinatawag natin ay throaty at saka yung free gas. So, ano bang nangyayari sa bloat? What happens when there's a bloat? So, bloat is a technical term in which the gas in the rumen and nag-accumulate in a excessive amount. So, nangyayari sa rumen, nag-expand yung rumen at saka sa sobrang pag-expand ng rumen ay mapupush yung lungs at saka heart at ika-crush niya yung lungs at saka heart. So, mangyayari sa hayop natin ay mahihirapan siyang huminga and eventually mamamatay siya. Yung types ng bloat ay meron tayong throaty at saka yung free gas. So una, yung throaty, isa tong common na nangyayari pag yung kambing o yung baka natin o yung tupa natin or our sheep ay yung sobrang gutom. Sobra siyang gutom. The animal is very hungry and when released in the pasture, they tend to eat rapidly. So sobrang takaw nila sa pagkain. Nangyayari dun, nagkaka-bloat sila. So isa pa is they ingest too much legume or protein source from grass. Nangyayari yan, too much protein or too much legume sa kinakain nila in their diet. It can lead to excessive gas accumulation. And isa pa is when they gain access to grain concentrates. This condition is also called grain overload. I had a case like this na yung baka, the cow scavenges the waste feeds of the poultry. Nangyari excessive accumulation of grains, dun namatay yung baka sa bloat. And isa pa is yung breeder goat gained access to the feed storage area of the chicken. Kinain niya yung feeds, high in concentrates, tapos yung namatay. So pag necropsy ko, ang daming feed sa loob, especially yung natira na lang ay yung corn grits kasi yung concentrates malulusaw yun. Nangyayari kasi pag nakakain sila ng grain concentrates ay nagbabago yung pH sa rumen. Tinatawag din natin yun na ruminal acidosis. So nangyayari, nag-accumulate yung gas saka nagkaka-bloat yung hayop natin na alaga natin. Ano naman yung nangyayari sa free gas bloat? Common to na nangyayari sa mga baka o sa mga kambing o sa mga sheep na matagal nang nakahiga or prolonged recumbency. Kasi nangyayari, nakahiga sila, either downer sila or may deficiency sila sa calcium, kahiga sila in a lateral recumbency, yung gas flow ay na-obstruct. So there is a physical obstruction in the gas flow. So cannot release the gas, and what happens is the gas is trapped inside. So common din to nangyayari sa mga surgery sa field, especially sa surgery ng mga ruminants na yung surgeon or yung team na nag-handle ng surgery ay walang consideration sa rumen. Sa practice ko sa field, I only have a window of 10 to 15 minutes if I ever had a surgery on a ruminant. I always consider my timeline of 10 to 15 minutes. And beyond that, I need to let the animal stand or rotate the animal on the other side. Kasi there are cases na nagka-straight, sobrang tagal ng time, nagka-free gas bloat na. And after surgery, hindi na tumayo yung hayop. Kasi na-neglect nila to na factor. So, doon naman tayo sa treatment. So, what is the treatment? So, in my experience, If the bloat is still mild, you can see that the animal has a swallowing reflex, you can give mineral oil. So you drench mineral oil, just make sure na the key in drenching safely, the eyes and the nose are at level na. As you can see, this is the eyes and this is the nose in a level position, because if you tilt, it can lead to asphyxiation pneumonia. Kasi baka pag drench nyo, dun pupunta sa lungs kasi mahirapan huminga yung hayop natin. The animal has a difficulty in breathing. So, and if it's so low, hindi naman siya makakaswallow. So, my key and my technique is that the eyes should level with the nose. I conduct drenching if the animal has a swallowing reflex. If the animal has still active swallowing reflex. Kasi hindi pa siya mahirapan nun. But if in conditions that the animal is already lying down, obvious manifestations of difficulty in breathing, so I don't give mineral oil. It can worsen its condition of having difficulty to breathe because I'm putting something in his airways, putting something in his mouth. So the animal won't swallow it because the animal will prioritize breathing. So in these conditions, especially in these very emergency situations, I conduct trocarization or binubutas ko na yung sa gilid ng rumen. I puncture the apex of the left side of the rumen to release the gas because it's already an emergency case. So swallowing is no longer the option of the animal because the primary goal of the animal is to breathe. And if you put something to swallow, it will hamper in the breathing of the animal. So the best and most practical solution is to conduct trocarization. And you can use either of the syringes depending on the size of the animal. If the animal is a small ruminant, then you just use the gauge 23 syringe. Now I have a case like that in my video in my archives. You can check that video out. And if the animal is a large ruminant, you can use the gauge 18, yung pink. So the key of treating bloat is that your treatment depends on the condition. In reality, when you face the situation, your decision is very important. So always choose the practical and the most effective way. And in my experience, when I conduct drenching in already debilitated and very severe case of bloat, it does not work. But trocarization in times of lateral recumbency, that the animal is already gasping for air, and I did trocarization and it is very effective. So just pull the skin and you puncture. And because when pulling the skin, we create a barrier, and by the time we withdraw the needle, pag inject natin sa needle, by the time na-relieve niya nga, pag tanggal natin sa needle at sa pag let go sa skin, the skin will cover the puncture area of the needle. So it will create a seal. So after relieving the gas, it is important that you give anti-inflammatory, flunixin or tolfin or dexamethasone, because the animal is in a very painful state. So that's about it. So thank you for being there on my day 12. As you can see, it's night time. So hopefully we can see each other in day 13. And as always, love.